Welcome back to the Fair in Focus podcast. New week, new guest. So this is the podcast where we take the female, women, and girl athlete injury prevention consensus papers and we try and make them useful. We try and make them something that everybody can understand, digest, use. That's the goal. So that's what we do. And today we're talking about lower extremity injuries. And I've got the privilege of being here with Dr. Garrett Bullock. Garrett is is the lead author of the Fair Consensus Systematic Review on Injury for Lower Extremity Injuries. So, by way of background, Garrett is an assistant professor of orthopedic surgery and rehabilitation in the School of Medicine at Wake Forest University in beautiful Winston-Salem, North Carolina. Garrett is also a former professional baseball player. Just learned, having played in the Houston Astros organization. Very cool. He's a physical therapist and he's a quantitative epidemiologist. So when it comes to sports injury and sport injury prevention, Garrett knows of what he speaks. Garrett, welcome to the podcast.
Yeah, thanks for having me today.
Yeah, that's awesome. So let's get into it. So when we say lower extremity injuries, what are we talking about? Like, what exactly are we talking about there?
Yeah, so that's really any injury from the hip down. So that could be the hip, thigh, knee, shin, foot, ankle.
Okay.
Yeah, so when we think about like anything above that, like low back, core, anything like that, it's more of like a trunk injury. So it's really hip and down.
I see. Okay, and then I mean, having read the paper, I mean, the research talks about a 50% of female women and girl athletes experiencing a lower extremity injury every season. That's remarkable. Like, is that normal? Is that the same for male men and boys too?
From say a 1 day time loss, which could be say I tweaked my quad or I
Yeah.
pulled my calf. Male and females is pretty close. But when we
Hmm.
look at specific injuries and we look at the burden of like higher intensity injuries, such from say a month lost or surgery,
Yeah.
particularly say ACL, then females are much higher than males when it comes from a percentage perspective. So
Huh.
yeah.
Why might that be, do you think?
There's a couple different reasons. I would say that at this moment we don't really have the full picture, but we
Mhm.
know that. So, and when we think about anatomically,
Okay.
females are particularly in the hips
Mhm.
slightly different than males. Then we also have the hormonal factors um, from um, from estrogen and
Yeah.
other types of hormones that change the way that the ligaments work with the joints and the muscles. But
Uh-huh.
then we also have to think about it from a sociocultural perspective.
Hmm.
That how what does the culture, what does the environment expect or push males versus females to
Right.
do within even within daily life, but also within how they play when they're young to at what is expected of them from sport.
Right.
So I think we don't know the exact percentage of all these different pieces, but it's
Mhm.
definitely a mixture of all of those that are contributing to this issue.
Oh, really interesting. Super interesting. I mean, being a former professional athlete and specifically a baseball player yourself, I wasn't a baseball pitcher, but I can imagine that when you're really, in the midst of throwing as hard as you possibly can, there's a lot of force being put on your lower extremities. Did you have any injuries, lower extremities yourself?
Yeah, so my career actually ended because of hip FAI, so a
Oh,
hip
okay.
injury with hip labrum, but it actually contributed to a lot of arm injuries. So I had surgery in my shoulder multiple times, my back, and then also my hip, and
Yeah,
also
yeah.
my core. So I've had them across the board.
Right.
Too many.
When we, again, knowing that the numbers are quite high when it comes to lower extremity issues, like, thinking from a professional sport organization, or even not even professional, just any sport organization or sport team management perspective, you know that there's going to be some lower extremity injuries happening to your players over the course of a season. How in your experience, like how do most sport teams or sport organizations approach that, knowing that it's quite likely there's going to be some injuries?
Yeah, so if you think about collegiately or above, so we're talking sub elite to elite.
Hmm.
So that could be, say, like Wake Forest level, or that could be to the Olympics and anything in
Sure.
between that. that when we think about from an organizational level, they factor in that there's going to be a loss of time for at least a couple of athletes, and depending on the sport, that what's going on and what level you are, that might be a lot or that might be a little bit. But that
Mm,
is factored into when you think the coach or the general manager or the sports medicine staff thinking about who's going to be available for the entire season. And yeah,
yeah. Wow. And so like typically, and we'll get into it just in terms of discussing the paper. In fact, let's do that. Let's get into the paper itself. So we talk the research talks about some interventions, right? So neuromuscular training, personal protective equipment, policy rule changes, and then just broader education, I think. So as far as the work of the FAIR consensus went, like the neuromuscular training evidence or research clearly came out as in terms of evidence as being, I guess, the most dominant or the most popular, I suppose. And
yep.
is that right?
Most
Okay.
popular.
Most
I'd say most
popular.
popular. Yeah.
Yeah, yeah, yeah. Is that when we compare that to like personal protective equipment or policy and rule changes, they were much less studied or much less drawn upon for evidence. Is that because they're genuinely just less studied, or is that because something like a policy rule change is harder to study, because it's difficult to measure versus something like an NMT or a neuromuscular training warm-up?
I think it's really a mixture of both. Some of it is that so some of these studies are done by say one investigator at one university,
Right.
and so that could be on one team or a couple teams, and
Okay.
so that doesn't while that does take a lot of resources, that doesn't take the same amount of resources as say if you're going to investigate the effect of neuromuscular training on all of Alberta or all
Right.
of Canada or
Right.
all of the United States. So
Right.
I think some of that is just that specific investigators, research scientists, sports medicine clinicians have certain teams they look after or certain teams they train with, and then they can study those. The
Okay.
other aspect is that it is more. It takes a different types of methods
Mm,
from a scientific perspective to investigate, say, a policy change.
right.
Compare and that most sports medicine researchers are not really trained in policy changing analysis. They're
Right.
more investigated in what is this exercise versus this exercise due to say hamstring strength.
Yeah.
And
Yeah.
so I think some of it is also that. I wouldn't say it's more difficult. I think they're about the same difficulty, but it's a different type of scientific study
I
that
see.
involves for those things.
So maybe further down the road, that's fertile ground to do more work in, I suppose, right? When we come to
Yeah,
think about
it's
fair.
absolutely. Yep.
Okay, okay. So, and again, as far as the NMT or neuromuscular training programs went, and especially for ACL and ankle injuries, there was a lot of evidence to suggest that widespread implementation of neuromuscular training would be a positive thing, right? So, for example, for ACL injuries, I think the research suggested like a reduction of 61%, I believe,
Yep.
which is incredible. That's massive, right? So what made the ACL evidence so much cleaner, maybe and more consistent than say just general lower extremity injuries?
Yeah, so I think that's a great question. So when you think about the ACL, it's within the knee. It's in one joint, and we're
Yeah,
talking about really one ligament or a couple ligaments that are kind of combined together within the knee,
yeah,
compared to lower extremity, which is from the hip to the foot,
right,
and so
right.
that's a lot more broad.
Yeah,
So for the specific questions that are asking, getting more precise means there's less noise, there's less variation across people. So it's easier to get to the signal of what is the effect. And
right.
so an ACL 61% reduction in injury
Yeah,
rates across that.
yeah.
Yeah.
I mean, that's an astounding number. 61% is amazing, right? For something that's in terms of entry point, it's like really like a low burden intervention, right? Like a
Mhm.
neuromuscular training. What makes it from a policy like large scale implementation of something like an NMT program? Like what do we need? What needs to be in place to make something like that successful, do you think? Like from a team or organization or just even like a system perspective, like what needs to be in place to make that a reality?
Yeah. Yeah, that's a great question. And that not this paper, but another one
Yeah.
really focused on that. I don't know if you've done that interview for the podcast yet.
Yeah,
So they go really into that, but I'll give some generals
sure.
that are also within the consensus. Is that you have to have some system level support, and that could be
Mm,
strictly from coaches or parents, or that could be from rec league administrators, or if you're thinking at higher levels, even
hmm.
high school or collegiate or professional, we're really thinking about from like the front office, as we call that, professional baseball
Yeah,
level of support, and that could be just like true just person's time, or that could be actual money. But for neuromuscular training, injury prevention strategies, it really doesn't require much money, or if any. All you
yeah,
need is your body
yeah.
and someone to coach you a little bit on training exercises.
Right. And then from a coaching perspective, just the commitment to doing it, right? Like the
Yeah,
commitment
yeah.
to saying
You
like,
have to
okay,
have
well,
buy-in.
yeah, you gotta make the
Yeah.
time to do it, right? Yeah,
And within the paper, that's why we talk about it as one of the major action points is that there's so low entry for this. I mean, you just
sure.
need some commitment from someone that could be a team leader, that's a high school athlete, that could be parents, that could be coaches, or that could be sports medicine staff. Say, hey, we're going to do this because we know it's effective.
Yeah.
Here's the exercises and training program, which doesn't need any special equipment. It's just literally your body and doing body weight exercises and progressing through different intensities,
Right.
and then keeping up with it, which is the
Yeah.
hardest part.
Yeah. Yeah. Well, take it from me. I know that's the hardest. Like extra fidelity to exercising consistently as you get older is the hardest part for sure.
Yep.
Okay, so let's shift gears just a little bit. Because we're talking about lower extremity issues, and again, people might be listening to this, or people might be coming to this, not having time to plow through a lot of research and data, and they might think to themselves, okay. There's a good chance I might roll my ankle here, or I need to wear a knee brace or something like that. But the research says, or is limited, I suppose, in terms of the efficacy of doing that. I mean, I know one randomized controls trial said something like, ankle brace could reduce ankle injuries by like 68% or something like that. But it's one study, right? It's just one study. So what would you say to coaches or parents who are, again, coming into a season, knowing that there's a high probability that there's going to be like a lower extremity issue, and they're kind of getting ready. They're thinking to themselves, what do I need to have in place here beyond neuromuscular training? Or like, do I need to think about PPE or ankle braces? What do you think?
Yeah, I mean, from the systematic review meta analysis, ankle braces was the only one that had any efficacy.
Hmm.
And that was specifically for if you've already had if you have a history of ankle injury.
Right,
So it helps you reduce what we call recurrence for having multiple
right.
ankle injuries. But from initial ankle injury or your first ankle injury, we haven't really seen evidence from that.
Yeah.
Yeah.
Yeah, no, I thought it was really interesting, and I would recommend to listeners to go on to fairconsensus.com and look at some of the recommendations because one was very interesting, and it was lower extremity, and the suggestion was do like not to wear a knee brace
Yep.
for an
Very true.
initial, right, like so
Yep.
subsequent injuries maybe, but not initially, right? So excuse me. So, oh, that's fascinating. Anyway, okay. Conscious of the time here, conscious of people's attention here. Let me ask you a couple of last questions. If, knowing what you know, and if you had unlimited, say, funding or resources to put towards a follow-up study on lower extremity injuries for female women and girl athletes, where would you put it? What would you spend it on?
I would spend it on trying to create environmental context for how to sustain these prevention programs within different levels of play, but
Hmm.
within different geographies and cultures. That could
Hmm.
be indigenous,
Interesting. Yeah.
that could be rural, that could be
Yep.
inner city, that could be North America, or that could be South America or
Sure.
Australasia, etc. So that if I had unlimited resources and money, that's what I would do. We know that these neuromuscular training injury prevention exercises and programs are effective,
Hmm.
um, but we it would be able to have them be sustainable within, say, someone's hometown, small hometown within their rec league soccer team, or inner city high school basketball, and everything in between those. Is that we really haven't found the true answer to making it be able to last as something that people just do. It's just like,
Right.
everyone gets up and brushes their teeth every day.
Yeah.
Uh,
Yeah.
like how do we make it to that point
Hmm.
where it's just like, well, if I'm playing soccer and I'm 11 or 15, or if I'm playing basketball, that is part of the deal is,
Yeah.
the first 12 to 15 minutes is that we do this injury prevention neuromuscular training warm-ups.
Yeah. Yeah.
That
I
would be
know.
where my money would go.
Yeah, that's very much. And I mean, on that note too, like any last comments or thoughts just about your work and walking away and what you think people uh, need to most think about and know just in terms of the lower extremity injury work.
I think I would just harp on we know that it's very effective.
Mm,
It's just getting people to really keep up with this type of exercise. It only takes 12 minutes.
yeah,
Um, it's you need zero equipment. You just need yourself,
right, right.
um, and then be able to, and, you do it within the first part of the as part of your warm up strategy within practice, and we see how well that works.
Yeah, that's I mean, amazing stuff. I mean, when we think about this whole globalization or universal kind of approach to injury prevention, something that is free, accessible, anybody can do it, literally anywhere. That seems like a good solution to me.
Yep.
Yeah. Garrett, that's it. That's all we have time for. So thank you for joining us today. Thanks for doing your work on lower extremity injuries. Um, as I said, if you want to learn more about the recommendations or the papers themselves, please go to fairconsensus.com. It's your repository for all things uh, female, women, and girl injury prevention led. And tune in next time. We'll be profiling somebody else who is involved in this in the Fair Consensus papers, and we can talk more things about injury prevention for female, women, and girl athletes. Garrett, thanks again.
Yeah. Thank you.